40-year-old woman presents to the outpatient clinic with a mass located on her right parotid gland. The patient's face appears to be distorted. When asked to smile, the right side of her mouth did not move. Saliva was accumulating in the right cheek and dribbling from the corner of her mouth. The physician suspects a facial paralysis due to the compression of the facial nerve at which location. We will discuss the facial nerve in more detail. The facial nerve will leave the skull with cranial nerve number 8 via the internal acoustic meatus. As this facial nerve courses down, at the level of the geniculate ganglion, we are going to have a branch called the greater petrosal nerve. The facial nerve will eventually enter into the facial canal. Within the facial canal, we're going to have two branches we want to be aware of. We're going to have the nerve to the stapedius muscle, and we're going to have chorda tympani. The facial nerve will exit the facial canal via the stylomastoid foramen. Below this, we are going to be innervating the muscles of facial expression. The mnemonic I use for the 5 branches of the facial nerve is 10 zebras bit my cookie. The T stands for temporal nerve, the Z, zygomatic nerve, the B, buccal nerve, the M, mandibular nerve, and the C, cervical nerve. In this case, our patient had facial paralysis and no other additional symptoms. If we look at the level just below the stylomastoid foramen, we know that motor innervation is going in this direction. Therefore, starting off with a lesion at the level of my stylomastoid foramen, that's when we're going to see an issue with the muscles of facial expression. If I have a lesion within the facial canal, I'm going to have an issue with facial expression on that affected side. And I'm also going to have hyperacusis due to the fact that the nerve to the stapedius muscle is affected. I'm also going to have loss of taste because we know chorda tympani will do anterior 2/3 of the tongue taste. Another lesion we can discuss is the lesion at the level of the geniculate ganglion. That patient is going to have lack of facial expression on the affected side. They're going to have hyperacusis and they're going to have a loss of anterior 2/3 of the tongue taste. Additionally, they are going to have dry eyes because of the effect of the greater petrosal nerve. The final one, if I have a lesion at the level of my internal acoustic meatus, that's going to result in a situation where I'm going to cut out facial nerve and my cranial nerve 8. The patient will have deafness and will have the inclusion of all the symptoms we mentioned before. They're going to have lack of facial expression. They're going to have lack of anterior 2/3 of the tongue taste. They're going to have lack of lacrimation. You want to be able to differentiate between these 4 lesion sites for facial nerve. And now that we have discussed the facial nerve in more detail, we're able to pick up that in this question, we are going to have facial paralysis, specifically on the right side of the face, due to compression of my facial nerve below the level of the stylomastoid foramen. Therefore, the correct answer we have will be D. Feel free to like and subscribe to the YouTube channel. If you have any questions, don't hesitate to contact MedTutors on the email provided in the description.